Good morning, students. Now, today I'm going to discuss prescription exercise 3. That is the last session of prescriptions, last 9 prescriptions with you. This is my practical class. The first prescription is write a suitable prescription for acute gout. Now, acute gout, as you know, it is the condition in which there is accumulation of the uric acid in the joints. So, there will be pain in the joints and inflammation will be there in the joints due to accumulation of uric acid. Formation of uric crystals in the joints will be there. So, there will be pain in the joints. The drug prescribed for this acute gout is capsule indomethacin. It is the NSAID, non-steroidal anti-inflammatory drug, indomethacin. It is known to, it has the high and repeated doses are given. It inhibits the uric crystal phagocytosis. The uric crystal which are formed in the joints, they cause phagocytosis. So that is inhibited. And chemotactic migration of leukocytes into the inflamed joint is also inhibited by the indomethacin. It also reduces the pain and inflammation, and it also reduces the chemotactic migration of leukocytes into the inflamed joints. Next is colchicine. Capsule indomethacin 100 mg 2 times a day for 7 days. And tablet colchicine, which is the anti-mitotic drug, that is, it inhibits the process of mitosis. It causes depolymerization of microtubules in the granulocytes. So it inhibits the granulocyte migration and phagocytosis. And it also inhibits the release of glycoprotein, reduces inflammation and joint destruction. It also inhibits the release of glycoprotein, and it also reduces inflammation and joint destruction, and it is the mitosis inhibitor. Colchicine, it inhibits the granulocyte migration and phagocytosis. Now, colchicine 0.5 milligram, 2 tablets stats. 0.5 milligram colchicine is given in the case of acute gout. 2 tablets immediately it is given on the spot. Then 1 tablet every 2 hours till pain subsides. Then 1 tablet is given every 2 hours till pain subsides and diarrhea occurs. We have to avoid meat because uric acid is aggravated if we take the proteins like meat, chicken, pulses. So we have to avoid the protein diet. Follow up after 7 days. Follow up after 7 days. This is the suitable prescription for acute gout, in which NSAID, indomethacin is given, and colchicine, which is mitosis inhibitor. It inhibits the pain and inflammation, that is given. Next is write a suitable prescription for chronic gout. Drug used in chronic gout, that is caused due to accumulation of the uric acid in the joints. So there will be destruction of the joints will be there due to accumulation of uric acid in the joints in chronic gout. And for the treatment, we give the drug which either decreases the formation of uric acid, that is inhibits the formation of uric acid, that is allopurinol, or we can also give the drug which increases the excretion of the uric acid from the kidney, that is probenecid can be given. But in this case, we are giving only one drug, that is tablet allopurinol, that is 100 milligram for 5 days, then 2 tablets OD for 5 days. For first 5 days, it is given 100 milligram, 2 tablets OD for 5 days, it is given, and maintain at 3 tablets OD. And we have to maintain at 3 tablets OD. We have to avoid chicken, meat, and pulses and follow up after 2 weeks. We have to follow up after 2 weeks. Allopurinol, as it is the xanthine oxidase inhibitor, so uric acid formation is inhibited. That is, hypoxanthine is not converted to xanthine, and then xanthine is not converted to uric acid. So this uric acid formation is inhibited by allopurinol, and thus the formation of uric acid does not take place. Write a suitable prescription for rheumatoid arthritis. Now, rheumatoid arthritis, the tablet given is methotrexate, which is the immunosuppressant drug. and it is the DMARD. It is the first choice DMARD. It is the dihydrofolate reductase inhibitor, folate antagonist. DMARD is disease modified anti-rheumatoid drug, and it is the potent immunosuppressant and anti-inflammatory action, rheumatoid arthritis. It inhibits the proliferation of the activated T cells, cytokine production, and chemotaxis of the neutrophils. There will be less cytokine production, then chemotaxis is inhibited and proliferation. Cytokine production is inhibited, chemotaxis of neutrophils is inhibited, and proliferation of activated T cells is inhibited. And there is apoptosis in the immune inflammatory cells. The immune inflammatory cells which cause the inflammation in rheumatoid arthritis, that cells get apoptized. It is the demand of first choice. First choice line drug for the treatment of the disease progression. It decreases the progression of the disease in the patients of rheumatoid arthritis. The first line drug is the methotrexate. Now next is piroxicam, which is the pain and inflammation anti-analgesic and antipyretic and anti-inflammatory capsule. Piroxicam 100 mg OD for 1 week with meals. We have to give with meals piroxicam, which this NSAIDs, they cause the symptomatic relief. They reduce inflammation, pain, and swelling, and morning stiffness is also reduced, and they improve the joint function. They improve the joint function. They do not decrease the disease progression just like methotrexate. These have the symptomatic relief. So they will reduce inflammation, pain, and swelling. Morning stiffness will be reduced, and they will also improve the joint function. Follow up after 1 week, and we have to follow up after 1 week. We have to follow up. Now write a suitable prescription of multibacillary leprosy. Now leprosy is a disease in which there is nerve involvement, there is degeneration of nerves and extremities, they get involved. So the tablet given is rifampicin, capsule rifampicin 600 mg once a month supervised for 12 months. For 12 months, we have to give the rifampicin once a month, means once a month it is given on the first day of the 28 days it is given, and just under supervision, means under the supervision of the healthcare worker. The patient has to come to the hospital, and under the supervision of the healthcare worker, the patient has to take the medicine. Dapsone 100 mg OD for 12 months, means on every day the Dapsone is given for 12 months, and clofazimine 300 mg once a month, that is 1 day of the 28 days under supervision clofazimine is given, and 50 mg OD for 12 months, and for the rest of the days 50 mg is given, that is 2 to 28 days 50 mg OD. For the 12 months clofazimine is given. Follow up after every month. We have to follow up after every month. The multibacillary leprosy, the simplified version is that on day 1 we give rifampicin 600 mg once a month, clofazimine 300 mg once a month, and Dapsone 100 mg. And daily treatment 2 to 28 days is clofazimine 50 mg and Dapsone 100 mg we have to give. Duration of treatment is 12 blister plaques, that is 12 months we have to give. And rifampicin 2 tablets are given of 300 mg each, and clofazimine 3 tablets are given of 100 mg each. Next is write a suitable prescription for iron deficiency anemia. Now, iron deficiency anemia is the anemia which occurs due to deficiency of iron. So, tablet parasulfate, which is the oral tablet, 200 mg OD after meals for 1 week. It is given. Parasulfate is given 200 mg OD after meals for 1 week. Advice intake of green leafy vegetables. We have to advise the intake of green leafy vegetables because green leafy vegetables also contain a good amount of iron. So we have to advise the patients to take green leafy vegetables. and follow-up after 1 month. Ferrous sulfate tablet is given to control the iron deficiency anemia. 200 milligram OD after meals is given because it causes acidity given empty stomach. Write a suitable prescription for peptic ulcer due to H. pylori. Now, H. pylori is the bacteria which attaches to the gastric mucosal membrane and it activates the urease activity. So, formation of the ammonia can take place. When ammonia is formed, then it can also liberate H ions in the gastric mucosal region, and so more H ions will be liberated, leading to more gastric acidity. For that, we have to give antibacterial drugs like erythromycin, which is the macrolide group of drug. It can be given to control the to kill the bacteria. 250 milligram TDS for 2 weeks. The regimen is for 2 weeks, that is for 14 days. The triple therapy is given. 250 milligram 3 times a day for 2 weeks is given, and amoxicillin, which is also extended spectrum penicillin. Capsule amoxicillin can be given 500 milligram TDS for 2 weeks. Omeprazole, it is the proton pump inhibitor. Proton pump inhibitor capsule omeprazole is given. It will inhibit the hydrogen potassium ATPase pump. It will inhibit the hydrogen potassium ATPase pump. So there will be no liberation of H ions in the gastric, in the lumen of the stomach. No liberation of the H ions, so no acidity will be there, and it also and it is the irreversible inhibitor of hydrogen potassium ATPase pump. It is the hit and run drug. 220 milligram BD is given. BD means twice a day, half an hour before meals. It is given on empty stomach because antacids can reduce its action. They can decrease the action of the proton pump inhibitors because proton pump inhibitors are only active in the acidic medium. So we have to give empty stomach before meals so that basic medium is not treated for 2 weeks. Avoid spices, caffeinated beverages. We have to avoid spices to control the acidity, and beverages like Coca-Cola, Pepsi should be avoided. Follow up after 1 week. We have to follow up after 1 week. We have to follow up. This is erythromycin, 2 antibacterial drugs along with proton pump inhibitors given for the treatment of the H. pylori infection due to peptic ulcer. Now, gastroesophageal reflux diseases, when there is uh, reflux of the acidic contents of the stomach contents into the esophagus because of the decreased tone of the lower esophageal sphincter. When there is reflux of the acidic contents into the esophagus, that is known as gastroesophageal reflux disease, and the treatment given is capsule omeprazole 20 milligram OD 1 hour before meal for 7 days. Means we have to give omeprazole, which is the proton pump inhibitor. This you know that this is histamine, which is the which acts on the G protein stimulated type of receptors and stimulates the GS, and it activates the cyclic AMP, and it also activates the protein kinases, which further activate the hydrogen potassium ATPase pump to liberate the acid, that is hydrogen ions in the uh, stomach. GI prostaglandin analog is inhibitory prostaglandin analog. It is the PGE2, which is the inhibitory type of the receptor. It will inhibit the function of the protein kinases, so no uh, ions will be liberated. Acetylcholine, it is on activation, it will release the calcium ions, which will activate the protein kinases, and it will activate the hydrogen potassium ATPase pump. So, and gastrin, phosphate polycystokinin receptor, It will also activate the protein kinases and it will activate the hydrogen potassium ATPase pump. So, for the treatment of peptic ulcer, we use antihistaminics, prostaglandin analogs, anticholinergics like benzene, and hydrogen potassium ATPase pump blocker omeprazole can be used. Domperidone is the prokinetic drug. It will increase the gastric emptying time. It will increase the gastric emptying time and it will increase the tone of the gastroesophageal, lower gastroesophageal sphincter. It is 10 milligram TDS, means 3 times a day for 7 days is given. Follow up after 7 days. Avoid spices, caffeinated beverages. We have to avoid the spices and caffeinated beverages, and we have to avoid the heavy dinner because in the morning the gastroesophageal reflux disease can occur if we have taken the heavy dinner. Now write a suitable prescription according to DOTS, that is directly observed treatment short course regimen for a case of smear positive pulmonary tuberculosis. Now for this we have the regimen as isoniazid, rifampicin, ethambutol and pyrazinamide for 2 months in the initial phase, and in the continuation phase isoniazid and rifampicin for 4 months. So isoniazid tablet 600 milligram, tablet rifampicin 450 milligram, tablet pyrazinamide 1500 milligram, tablet ethambutol 1200 milligram, all thrice a week for 2 months, followed by tablet isoniazid 600 milligram and tablet rifampicin 450 milligram, all thrice a week for 4 months. We have to maintain personal and public hygiene and protein rich diet should be preferred, and sputum smear for acid fast baseline at 8 weeks, 16 weeks and 24 weeks. Means we have to check for the sputum smear examination has to be done for the acid fast baseline at the 6, 8 weeks, 16 weeks and 24 weeks. 3 times the test should be done. Sputum smear test should be done. That is HRZE for 2 months followed by HR for 4 months. Now write a suitable prescription for the case of acute attack of asthma. Now, acute attack of asthma is the condition in which there is acute attack, that is the patient suffers from the asthma uh, immediately. Now the drug given is inhaler salbutamol, that is beta-2 adrenergic drug, which causes bronchodilation of the bronchioles and other alveoli. Bronchioles will be bronchodilated. So there will be salbutamol, which is the shorter acting beta-2 adrenergic agonist is given. 100 microgram per puff is given. 2 puffs are given QID or SOS for 3 days. QID is 4 times a day. SOS means as and when required for 3 days. Salbutamol can be given, or inhaler corticosteroid, which reduces the inflammation and it is the mast cell stabilizer, and it also causes the it reduces the inflammation of the bronchiolar tracts and reduces the mucus secretion, which is also anti-secretory. So inhaler betamethasone, which is the inhaled corticosteroid, is given. 200 microgram per puff is given BD 2 times a day for 3 days. Avoid dust fud pets because this can aggravate the asthma. These pollens dust can aggravate the exacerbation of the asthma. So we have to avoid the dust and fud pets. Follow up after 3 days. After 3 days we have to follow up. Now this is all for the prescription session. Hope you understood. Thank you. Stay safe.